So good evening, friends. Meeting again with the organ of medicine, the practical part of the organ of medicine. In yesterday's session, we have discussed regarding the definition of chronic disease defined in the 72 aphorism. And we have learned the thorough aspect what Hahnemann wants to explain about the chronic disease in that definition. So chronic disease, as he defined, is very clear-cut idea regarding the disease which he has mentioned. In acute, there is a period of prodrome, there is a period of progress and period of decline, but which is not there in case of chronic. There is period of prodrome, period of progress, but no decline. There is directly a death, which is the only last thing which happens in the chronic disease. Acute diseases, he has explained, they are self-limiting disorders, either turn into self-limiting disorders, recover themselves, and person becomes again healthy when the acute miasm subsides. Chronic is not like that. When you deal with the chronic, you will find that chronic never comes to the normal itself, because it is caused because of chronic miasms. So that differentiation between acute disease and chronic disease, which we have discussed, and we have started discussing about the 73 aphorism, the part of which we have discussed in yesterday's lecture. Hahnemann classified the acute diseases into 4 varieties. The first 2 varieties where the susceptibility plays a vital role, and those we have discussed in yesterday's lecture. So first variety is individual variety or indisposition, caused because of some exciting cause. The cause might be biological, it might be physical, it might be chemical, it might be psychological, but the thing which excites the disease is called as a first variety, that is the indisposition. Indisposition expresses in 2 ways. Indisposition may be of a mild character or indisposition might be of a violent character. Generally, indisposition of a mild character never requires any medicine. Indisposition of a violent character always requires a homeopathic simile. So one must able to understand what is the importance of it and how to find it out remedy in case of indisposition of a violent character. The second variety which we have discussed is the sporadic, caused because of telluric and meteoric experiences. That means the environmental factors. And again here, the people here and there suffers because of telluric and meteoric experiences, but those who are susceptible only will going to suffer. So again, a susceptibility plays a very vital role in such types of cases. So first 2 varieties depends upon the susceptibility rather than anything else. But the next 2, which we're going to discuss, are caused because of something else. And that's what the terminology Hahnemann has used the way back. And his concept was rather clear regarding those diseases. So we'll go ahead with the after finishing the first part of that 73 aphorism. In the mid of the 73 aphorism, we were there. We have discussed about the sporadic diseases, and then the next sentence, what he says. Allied to these are those diseases in which many persons are attacked with very similar sufferings from the same cause, that is epidemically. These generally becomes infectious, contagious when they prevail among thickly congregated masses of human beings. So third variety which he is expressing is the epidemic diseases. And what he says, they are caused because of contagious principle, infectious principle, to which he has used one terminology at the end of this aphorism, that acute miasm. They are caused because of acute miasms. And this was the terminology used by Hahnemann a way back. This was the terminology which is related with the Hahnemannian concept of the viruses, bacteria, parasites, and to which he has denoted it with the name of acute miasm. And he has explained that they are caused because of the contagious principle. And what he says, when they prevail among thickly congregated masses of human beings. So where there are many people who are there, gets communicated from one person to another person in very fast. Thence arise the fevers in each instance of a peculiar nature. And because the cases of disease have an identical origin, they set up in all those, they affect an identical morbid process, which when left to itself terminates in a moderate period of time in death or recovery. The calamities of war, the inundations, calamities of war means the bad instances which happens because of the war, the dukkhad ghatna. Inundations म्हणजे there is a flood, पूर येणं मोठ्या प्रमाणात, फेमाईन, दुष्काळ पडणं. The calamities of war, inundations, and famine are not infrequently their exciting causes and producers. Sometimes they are peculiar acute miasms. Underline this and acute miasms, the terminology which he has used, acute miasms, which recur in the same manner, hence known by some traditional name, which either attack the persons but once in lifetime, as smallpox, measles, whooping cough, the ancient smooth, bright red scarlet fever of Cinderam, the mumps, etc., or such as recur frequently in pretty much in the same manner, the plague of Levant, the yellow fever of the seacoast, the Asiatic cholera. So he has explained the two varieties of the acute miasm. The first variety, recurring, non-recurring. So smallpox, chickenpox, they happens to be there once in a lifetime. They never recur. And these are the disorders which are caused because of this acute miasm, the infectious principle, which Hahnemann explained. And he was not having any instrument, he is not having any scope to look toward them, or he never have a microscope in his hand. Still, he came to the same conclusion. It was only because of logical process with which he has approached. And what is the importance in these two varieties, epidemic and endemic, that epidemic diseases which are prevalent at many people here and there suffers from the same cause at a different places is epidemic. And when the diseases are caused because same contagious principle but residing in one particular locality, it is called to be endemic. And both of them are caused because of acute miasm. And this terminology is specifically used for those causes which he labeled by the name of acute miasm for the viruses, bacteria, and parasites. See, one important thing which Hahnemann mentions over there, those diseases which are caused because of epidemic and endemic, they are dependent on the virulence of the acute miasm. They never depend upon the susceptibility. Susceptibility plays a passive role in cases of epidemic and endemic diseases, whereas active role is played by the severity or virulence of the acute miasm. And that's why many people at a time suffers from the same cause, because here the virulence of the organism is more stronger than the susceptibility. So even though the person's susceptibility is not too high, he suffers because of the epidemic disease, he suffers because of endemic disease, and that's the reason. So the approach changes. When you think about the individual variety, when you think about sporadic disease, your approach is rather different. And when you treat the epidemic diseases or endemic diseases, your approach changes. In case of epidemic, in case of individual and sporadic diseases, you have to treat the patient individually. Even in epidemic and endemic, you have to treat them individually. But for the epidemic and endemic disease, you can find it out a remedy of that epidemic, and which can be used as a remedy of that epidemic, the genus epidemicus, for the preventive purposes. Those who remains to be in the state of health, this remedy can be given as a prevention, not for the curative purpose. Cure is always dependent upon the individual case. So every patient who presents with whatever may be the characteristic totality on which you have to find it out a remedy in genus in the epidemic and endemic cases. But in epidemic and endemic cases, one important thing which you have to take into consideration that you can find it out remedy depending on the common characteristics of that epidemic, and that remedy is the genus epidemicus for the prevention for the healthy persons. So approach rather changes in individual and sporadic as compared to the epidemic and endemic. Second important thing, this is my thought of understanding it. In case of individual variety or sporadic diseases, you don't have to repeat medicine too much. But because there is susceptibility is rather high. But in case of acute, in case of epidemic and endemic diseases, where the disease is caused because of acute myasm, and it depends upon the virulence of acute myasm, sometimes it requires little bit repetition. So if it is a chicken pox, if it is a smallpox, if now the smallpox is eradicated, but if it is a mumps, you might require repetition of the remedy. You have to ask the patient to visit you daily and find it out how the patient's condition is there, and you have to repeat it if the things are not getting in right direction. Because you have to boost up your energy with the help of your remedy. So approach in the process of administration of the remedy changes. And that's why we have to understand what type of acute disease it is, whether it is individual, whether it is sporadic, whether it is epidemic or endemic. So first two, repetition is little bit less, but in epidemic and endemic, you might require a repetition. It varies from case to case, but you must know that thought in your mind. So this is the classification of acute diseases, and then there is a one footnote which Hahnemann have mentioned regarding the naming of the diseases. During Hahnemannian time, there was a method that to name the diseases, and even today it is the same method is followed in allopathy, modern science. So Hahnemann explains that if you give or label the name, label the disease by name, when you treat those patients with homeopathy, you might get a prejudiced. So naming the diseases is rather difficult. Instead of that, you should not name that disease, find it out what is the totality and find it out the right remedy. Sometimes it happens that if you, for example, we'll take a recent example, the COVID, the name was given COVID-19. But if you find it out, it changed its strength in 20 and it expressed in a different manner. Still, you have given the same name to the disease. And Hahnemann have criticized this aspect that naming the diseases, even though the presentation varies, then it makes the difference in the people's mind. They start treating that patient in the similar manner. And that's why giving such names is rather problematic for the homeopathic therapeutic. So he has written one footnote to that. We'll go, there are two footnotes to this paragraph. So first footnote, footnote number 72. The homeopathic physician who does not entertain the foregone conclusions devised by an ordinary school, who have fixed upon a few names of such fevers, besides which mighty nature dare not produce any other, so as to admit of their treating the diseases according to some fixed method, does not acknowledge the names gall fever, bilious fever, typhus fever, putrid fever, nervous fever, or mucus fever, but treats them each according to their several peculiarities. So, with allopathy, they labels the name. They labels it. It is putrid fever, it is gall fever, whether it is a bilious fever, and accordingly, with the fixed name, their approach is there. With homeopathy, we never label it. We find it out what are the characteristics, how the patient is presenting. If the patient comes to you and he expresses, doctor, I was absolutely better yesterday, and at 4 o'clock in the morning, I got the rigors. I had a very severe rigor followed by tremendous fever, and afterwards the sweating started. And now in the evening, I'm little bit better. So Patient had given you something very important with which you can give a remedy directly. Because the characteristic which he has mentioned, he has given the time modality. And he has explained the chill at 4 a.m., a specific modality. The modality which mentions only one remedy. Whether you label it by the name of malaria or a dengue or anything else, it doesn't matter. Your treatment never depends upon naming the diseases. You will not approach with name of the disease. You will not, your remedy will not change on the whether it's malaria or something else. Your remedy depends upon the characteristic of that patient. So what is the remedy? Remedy is very clear. Everyone knows. It is given in Kent's repertory. Chill, 4 a.m. And only remedy is Cedron. So if you give Cedron to the patient in the declining phase, that is when patient was not having acute rigor or any fever state, and he is in the sweating stage or he is in between phase, if you give the Cedron, and if it is the right remedy for that patient selected on this specific modality, he will not have a second attack of the malaria. So this is very important. Every patient we treat with their specific modality, specific sensation. And those things matters a lot when you deal with the patient. So what he wants to explain, that instead of naming the disease, it will not going to give anything as from the homeopathic point of view, but finding it out the characteristics which matters a lot in such types of cases. So these are very important things which he has mentioned in that footnote, that instead of labeling the disease, you must find it out what are the vital characteristics on which you can prescribe the remedy. Another patient enters in your clinic, but he is having the similar rigors, but he explains that, doctor, at 12 o'clock at night, I got the rigor. He has given directly, he has given time modality. At 12 o'clock at midnight, I got the rigor. So your remedy now changes, you, even though it is malaria. So you give him the arsenic album. So it varies from patient to patient depending upon the individual characteristic of that person. There is one more footnote which he has mentioned. Subsequently to the year 1801, a kind of Purpura miliaris, which came from the West, was by physicians confounded with the scarlet fever, notwithstanding that they exhibited totally different symptoms. That the latter found its prophylactic and curative remedy in belladonna, the former in aconite, and that the former was generally merely sporadic, while the latter was invariably epidemic. So he was classifying the diseases, and he was saying that they are not very clear. They are having different presentations. And those presentations one must understand. By labeling the same name to the disease makes it a problem for you. It should not create a problem. So your treatment depends upon what patient presents, how the patient presents, what are its manifestations, what are the characteristics which he presents, and that matters a lot in treating the patient. So he has given one example that first epidemic was treated very clearly with belladonna and another was with the aconite. Of late years, it seems as if the two occasionally joined to form an eruptive fever of peculiar kind, for which neither the one nor the 8 other remedy alone will be found to be exactly homeopathic. So another time, another epidemic came where the presentation was mixed, and then there was no aconite, there was no belladonna as a prophylactic remedy. That epidemic required something else. So every epidemic when presents has a different totality. And that's what we have taken into consideration. When we have learned, when we have gone through the COVID-19, we have learned that every time it has a different presentation. Today also we are getting different cases of COVID, and those are having totally different presentation. Now there are very commonly it is just a coryza and cough with sore throat. That presentation without having fever or fever is there. Fever remains only for 1 day or two, and presentation is rather different. Here the most common presentation is that the sore throat. Patient comes with sore throat. So it varies from every epidemic, and that's why instead of labeling it, find it out what is presenting in future and find it out the remedy for the patient. So this is what he wants to explain over there, that when you treat acutes, and then it is basically necessary to classify them into 4 types: the individual, the sporadic, epidemic, and endemic, and accordingly you have to decide your approach in treating those diseases. So this is related with the 73 aphorism, the classification of acute diseases. And now he turns to classify the chronic diseases. And we have to understand the chronic diseases in detail over there. So we'll go ahead with the first variety. Chronic diseases he has classified into three types. The first variety is artificial chronic disease. Second is pseudo chronic disease. And third variety is true chronic diseases. So in 74, he starts with the first variety of chronic diseases called as artificial chronic disease. Today we're going to learn the artificial chronic disease. Aphorism 74. Among the chronic diseases, we must still, alas, reckon those so commonly met with artificially produced in allopathic treatment by the prolonged use of violent heroic medicine in large and increasing doses, by abuse of calomel. Calomel means mercurious chloride. Abuse of calomel, corrosive sublimate, again a mercurial preparation, mercurial ointment, nitrate of the silver, iodine and its ointments, opium, valerian, cinchona bark and quinine, foxglove, prussic acid, sulfur and sulfuric acid, perennial purgatives. Perennial means which are used throughout the year. It's called as perennial. Barmahi. Perennial purgatives, venesections, shading streams of the blood, leeches. Leeches means applying the leeches. Zarwa. Issues. Issues was the method that they used to take thread over there and they used to produce the discharges from that. That is the issues. Cetons, it is one and same, it's the same method, which is nowadays called by the name of some acupuncture, but it is like that, etc., whereby the vital energy is sometimes weakened to an unmerciful extent. Sometimes, if it do not succumb म्हणजे बळी पडणं, if it do not succumb, gradually abnormally deranged by each substance in a peculiar manner, in such a way that in order to maintain life against this inimical and destructive attack, it must produce a revolution in the organism and either deprive some part of its irritability and sensibility or exalt those to an excessive degree, cause dilatation and contraction, relaxation or induration, or even total destruction of certain parts, and develop faulty organic alteration here and there in the interior or in the exterior, cripple the body internally and externally in order to preserve the organism from complete destruction of the life by ever renewed hostile assaults. Hostile assaults म्हणजे hostile प्रतिकूल assaults म्हणजे हल्ले. Hostile assaults of such destructive forces. So what is expressing over there? He is expressing that the first variety of chronic diseases, to which he labeled by the name of artificial chronic disease. And what are the causes? The causes are only one, that is the strong use of large doses of allopathic medicine. The medicines which we used to use during Hahnemannian time, which he has mentioned, He has mentioned the mercurial preparation, he has mentioned the silver preparation, he has mentioned regarding the methods which were followed in allopathy at that time, the venesections, applying the leeches, taking the cuts on the body, blood leaching, blood sucking, all those methods which were prevalent during his time, he has written. Today, the things are rather same. Today, you'll find it out the similar types of methods. Some variety is different. Now they used to use very strong medicines. The strong steroids which are used during the epidemic, just COVID-19 epidemic, they have used a lot of steroids, even remdesivir like injection. And all those have their impact on the body. There are multiple cases of avian developed after this COVID-19. In fact, the rate of avian is tremendously increased in last 6 months, 6-7 months. There are many cases who are having suffering from the myocardial infarctions all of a sudden because of thromboembolism. There are many cases who are suffering from lung fibrosis, interstitial lung disease. And these are the things which are developed because of the use of the strong heroic medicines which are used nowadays in the allopathy. Only the names of the medicines and derivatives of medicines are changed, but method is same. And that's why the peoples are suffering from complex diseases, which we have learned while discussing the what happens when two dissimilar diseases, natural diseases, mix inside human being. So either they repels, either they suspends and forms the complex or double complex disease. And this double complex disease is the commonest thing with which patient presents to us today. Many autoimmune disorders are the result of such artificial are nothing but produced because of this medicinal use. So hazardous effects which happens to be there because of those allopathic medicines used to produce artificial chronic diseases. And what Hahnemann says about them, they are rather difficult to cure. A curable patient becomes incurable. Many times, even when they comes to the homeopathy, they never yields very easily to the treatment. Here you have to utilize a lot of logic. You have to think a lot. You have to ask the patient to wait for a longer time of duration, and then they start yielding. This happens quite commonly with homeopathy when such artificial chronic diseases with which patient approach to you. And this is the first variety which Hahnemann mentions, that artificial chronic diseases caused because of heroic medicines which are used in allopathy. There are two important footnotes are there to this paragraph, and both footnotes we'll discuss in tomorrow's session, because those are where he has explained exactly the what happens, how allopath thinks, or how allopaths were thinking at his time. And that concept he has made it clear over there in both the footnotes. So we'll learn them tomorrow. Till that period, thanks a lot. Any questions, any queries? We have 5 minutes with us. Any questions regarding this? So today we have learned regarding the all 4 varieties of acute diseases and their aspect of approaching them, and first variety of chronic disease, the artificial chronic disease caused because of allopathic dominance. Any question, any query regarding this? अली बहुत लेट आ गए आज.
सर
बोल.
सर मला ते टॅरेंटिव्हला क्युबेन्स रिलेशनशिप रेमेडी रिलेशनशिप मध्ये कुठेच सापडत नाहीये सर. ड्युरेशन ऑफ म्हणजे किती दिवस ते काम करतं, मग रिपीट करावं का नाही करावं सर. टोटॅलिटी अगदी मॅच होते पेशंटला सर, तर मग कसं द्यावं.
पेशंट एक्यूट आहे का क्रॉनिक आहे?
क्रॉनिक आहे सर, क्रॉनिक आहे.
पेशंट क्रॉनिक असेल तर बेटर गिव्ह फ्यू डोसेस अँड वेट फॉर सम टाइम.
सध्या मी 200 BD सजेस्ट केलाय सर.
Not more
for
than
2 days.
Not more than 3 days. Maximum 3 days you give and wait for some time. Do you have the Rajan Shankaran sir's book, The Elements of Homeopathy, actually written by P. Shankaran, compiled by Rajan Shankaran. In his book, many remedy relationship are mentioned which are not there in regular your Borik's book. If you have it in the second volume, there are many remedies are added. You can get those in the P. Shankaran sir's book. The Elements of Homeopathy, 2 volumes by Rajan Shankar.
Okay, sir. Thank you.
You can get if it is there. I don't know whether it is there or mentioned or not, but many medicines have been added. Or another source is that if you have the Clark's Dictionary of Materia Medica, it is not the materia, it is a dictionary, it is repertory, sorry, Clark's Clinical Repertory. It is a small book, Clark's Clinical Repertory. In Clark's Clinical Repertory, he has given many remedies in remedy relationship, which are not there in the regular remedy relationship. So that you can get over there.
Yes, sir. Thank you.
दोन्ही पुस्तकांमध्ये
हो सर.
बघ आणि
हो सर, नक्कीच.
you use it and write it down your own aspect. That will be an addition by Dr. Madhu.
नाही सर. नाही सर, तुम्ही सांगितलं तर मी देऊ शकते.
असं व्हायला पाहिजे. This is what needed. This is the thing which is needed. If
तुम्ही प्रोत्साहन देता म्हणून प्रॅक्टिकल करायला हवं, म्हणून तेवढं तरी एक स्टेप अहेड गेलो आहोत सर, की करून बघतो. जे होईल ते होईल, बघूया.
करून बघायचं आणि ते लिहून ठेवायचं.
हो सर, हो सर.
डेटा पुढच्या पिढी करता उपयोगी आला पाहिजे.
Yes sir, yes sir. Thank you sir.
Okay. Thank you everyone who have attended today's sessions. Tomorrow we'll definitely meet. Saturday, henceforth Saturday there will be no lecture. Saturday, Sunday there will be holiday, and from Monday to Friday definitely sessions will be there. Even though yesterday I missed to send the message, and there are very few people who have joined. So from Monday to Friday there will be definitely a lecture. Very occasionally I miss the lecture, but Saturday it's a very high OPD is there and not possible to join. So Saturday and Sunday will keep the holidays. Okay. So thank you very much.
Thank you, sir.
And we'll meet again tomorrow at the same time. Thanks a lot.
Thank you.